Hello, this is Dr. Do again. This video is alphabetic list of problems on letter K. I had a previous video started with the kidney and kidney diseases. From previous video, I briefly introduced about the parenchymal cells of the kidney, which are the cubic tubule cells, and also there are another important structures in kidney, around the kidney. I think I mentioned previously the glomeruli. Basically, how to and I'm going to integrate this structure with clinical diseases. So, what are the glomeruli? I think I mentioned before. It's a globe of capillary wrapped by the capsules. Between the two layers of capsule, there's spaces. So that's where the fluid filtered through, and then those spaces connect to the tubules. So talk about this glomeruli. The major function for these glomeruli are the filtration. Filtration, just like you imagine, like sieving water through a basket, is the same idea. Why I say that? Because if you, I give you the idea about the filtrate amount. It's 120 cc 1 minute. So if you time 60, so give you 7,200 cc, which means 7 liters. How much is 7 liters? The 1 gallon jar of milk is about less than 4 liters. So 1 hour will be about a little less than this 2 gallon jar of milk. That's about the amount of filtration rate and amount. And if you imagine 24 hours, how much that would be. However, that's why the parenchymal cells, the cubic tubule cells, serves important function to reabsorb the filtrate ions or small molecules with water. So that's basically the function of this kidney structure. In terms of the molecules, details like small amino acid, glucose and irons, and so that's probably the main, and also of course the waste, creatine and BUN, they just washed out. So that's the major purpose for this process. In terms of integrate this structure with the diseases, talk about the glomeruli diseases, also like glomerulonephritis. I talk about that. For example, the post-strep glomerulonephritis is very, it's not common now, but probably a couple of decades ago it was quite common because it's associated with the strep throat. If it's not treated very well, or if not treated in time fashion, so that can cause this later on, the complication of the glomerulonephritis. The major mechanism for this disease is the autoimmune mechanism, generate antibodies, but in addition to recognize the bacteria, also recognize the glomeruli basement membrane as a foreign structure. So attack those endothelial cells. So then basically it's just the meltdown of this membrane, so everything just come out. Associated with these big molecules like the red blood cells are quite huge. So that's why this glomerulonephritis, the major clinical presentation are the hematuria. Red blood cells can come out. Usually the cells cannot, because this filtration membrane is really delicate, only for the small molecules like sodium, potassium, water, and creatine, BUN, something like this. But when this structure had, like I said, during the glomerulonephritis, this filtration membrane was disrupted, so the red blood cells even can passing down. So this is about the. There are another, I think I previously mentioned, there are another type of diseases associated with this glomeruli. Basically the membrane getting thickened, or the membrane getting not integrate, just break down, increase the space of the filtration slit, then the protein will come out. During the normal filtration, the protein usually minimum small molecule, basically no protein can be filtered out. But if these membranes had the slit, filtration slits getting bigger, so then the protein can come out. That's the proteinuria, with loss of proteins in the body, malnutrition, edema, and also proteinuria can be presented. So this is a quite common, a huge cluster of diseases called nephropathy, associated with this different kind of mechanism, either through the autoimmune type 3 of hypersensitivity, or there's some antigen antibody with complement deposit along the membrane, either segmental or is diffuse. So really a lot of diseases can cause this nephropathy, or some medication can cause this proteinuria. So this is about the glomerular, and of course there's some other conditions. In terms of tubule structure, usually the cubic cells has the receptors for the hormones to regulate sodium, water, potassium, reabsorption, even glucose. So any of those receptors, first of all, cannot function well, so then cannot receive the signal from the hormone, then will lose the electrolyte, cause the electrolyte imbalance. Or there's some conditions associated with this tubule structure and cause this damage, lysis, the cell itself, the cubic cells undergoing necrosis. So that's also quite common, either through the bacterial infection or the autoimmune mechanism, or idiopathic. There's no known mechanism, then just happen to this necrotic tubule structure, so then basically lost the function for absorption, cause the disease can be very serious. So this is about the structure, about this tubule parenchymal cells. Of course, there's some other associated diseases like the interstitial kidney disease, I think I mentioned previously, can cause by medication or chemicals, or autoimmune mechanism, and the clinical presentation is quite similar to the tubule or nephropathy. Actually, it's a nephropathy and interstitial kidney disease, quite similar. And there are another actual kidney itself can undergo the infection. Usually it's retrograde from the bladder going up to pelvis, so that cause the inflammation. If that's the case, associated with the fever, and usually it's affect both the parenchymal or mesenchymal cells and interstitial cells. So present as the fever and red blood cells, which are the inflammation cells inside of the urine, can be examined under the microscope. So this is about in terms of the cellular level, and also in terms of the structure connected to the diseases. Of course, there are a lot of other causes. The kidney disease is relatively common and quite comprehensive in terms of causes or clinical presentations or mechanisms, because it is connected to the other system in the body, like the endocrine system or any other systems. So that's why. But this video just serves as a brief introduction, and hope to trigger your interest. If you have questions, you can definitely search more, or you can find the interest topics that really trigger you to dig deeper. So I'm going to stop here, and thank you for watching. I will see you next time.